Hello, I'm Dr. Erin Elmore. I'm a licensed psychologist and I work with Triad as an educational consultant and test prep coach. I really enjoy supporting people through the process of preparing for and hopefully passing their licensing exams. And today we're going to be talking about the EPPP Part 1 and what you can expect on exam day. Let's get started. The exam for professional practice in psychology, or EPPP, is a qualifying exam for becoming licensed as a psychologist in the United States and Canada, and is part of the evaluation process for determining readiness to practice psychology. While most candidates taking the EPPP have earned a doctoral degree in psychology, completed a year of supervised predoctoral experience and postdoc experience, the requirements to sit for the exam depend on your state board regulations. In fact, many master's level psychologists are required to take the EPPP, so it's best to check with your state board to determine your specific needs. In 2021, the ASPPB launched the EPPP Part 2. The EPPP Part 1 exam covers knowledge, while the EPPP Part 2, which will not be covered in this video, covers skills. The EPPP Part 2 is currently available to candidates in states that require this part of the exam. However, not all states have this requirement at this time. By January 1st of 2026, all states will be required to adopt the EPPP Part 2. To sit for the EPPP, you must first apply to the licensing board in the state where you wish to be licensed. Even though the EPPP is offered throughout the year, it's important to know that the Pearson VUE testing centers administering the EPPP are also used by many other professional licensing exams, so the EPPP time slots can vary by each site. It's best to submit your documentation to the licensing board as soon as possible to avoid any delays in your registration and scheduling. Also, remember to double check the requirements for your specific state regarding the EPPP Part 2. So what exactly does the EPPP cover? The EPPP assesses the core knowledge required to practice psychology competently and independently and covers 8 content areas representing the larger field of psychology. You will be tested on core knowledge and your ability to apply that knowledge to scenarios commonly faced by psychologists. So you will need to know key terms, concepts, theories, and research. Each of the 8 content areas have varying degrees of emphasis on the exam, and they're broken down by the following percentages. Domain 1, biological bases of behavior, comprises 10% of the exam. Domain 2, cognitive affective bases of behavior, covers 13% of the content. Domain 3, social and cultural bases of behavior, is 11%. Domain 4, growth and lifespan development, is 12%. Domain 5, assessment and diagnosis, is one of the largest domains, covering 16% of the material. And Domain 6, treatment, intervention, prevention, and supervision, makes up 15% of the exam. Domain 7 is research methods and statistics, and thankfully only covers 7% of the exam. Finally, Domain 8 is ethical, legal, and professional issues and comprises 16% of the EPPP content. For more information about the domains and a more specific breakdown of those content areas I mentioned, you can refer to the EPPP Candidate Handbook at asppp.net. Of note, the EPPP categories are often a blend of the domains that are identified by AATBS. This is because breaking them apart makes it easier while you're trying to study. For example, the ASPPB EPPP domain of biological bases of behavior is comprised of AATBS's physiopharmacology, lifespan development, and abnormal psychology domains. You will have 4 hours and 15 minutes to answer 225 multiple choice questions. Each question has 4 answer options, and only one of them is correct. Here are a few things to know about exam day. You can skip questions and return to them later. You can also return to questions to check your answers. You can take breaks, but the clock is still running while you're taking your break. And finally, 50 of the questions on this exam are experimental questions, and they will not be scored, meaning they will not be scored for you if you get it right, and they will not be scored against you if you get it wrong. Students will not know, though, which questions are experimental, so treat every question like it counts. Here are a few more things to remember for your exam day. Make sure to bring your photo ID. And depending on your testing site, you may or may not be allowed to bring food or drink into the testing room, usually not. Remember, pace yourself and plan your breaks accordingly because the clock does not stop if you take a break. Once you have completed your exam and leave the testing room, you'll receive an unofficial score report of your scaled score. The scores will range from 200 to 800. Your score will also be automatically forwarded to your licensing board, and they will notify you of your licensure status. The Association of State and Provincial Psychology Boards, or ASPPB, recommends at least a 500 as a passing score for independent practice, but you should check with your state board to determine if they require a different score. If you don't meet the recommended cutoff of 500, you'll also receive a report with a bar graph for a performance of each domain when you've completed your test. Keep this report as you will no longer have access to it after you leave the testing center. If you failed EPPP and would like to retest, you must reapply to your licensing board for approval, as each state licensing board sets their own guidelines for retesting. Once approved, you'll be notified through Searcher.me, which is the EPPP registration system, and you will need to register for a new exam. Although not required, the ASPPB recommends that you wait approximately 90 days from your last test date to allow for adequate time to prepare for the exam. However, you can technically retest as soon as your licensing board approves you and your testing center has an available time spot. Rest assured that many test takers pass the EPPP on their first try. According to the ASPPB, 76% of first-time test takers passed the EPPP in 2018, with the majority of remaining candidates passing by their second attempt. For more information about the EPPP, including the EPPP Candidate Handbook, frequently asked questions, and myths and facts, refer to asppp.net. Thank you for watching this study series video about understanding the EPPP Part 1. For more information about the EPPP and to check out our EPPP study materials, go to aatbs.com. Best of luck to you on your exam.